Hey everyone, this is Nick with DentalRx, and today I'll be showcasing the DentalRx app for the FlutterFlow Imagine Competition. For those who don't know, DentalRx is a dental pharmacology app that allows dentists to research medications, calculate doses, safely prescribe, and ultimately provide better patient care. In this demo, I'll be showcasing all of the pharmacology modules in the app, and also be previewing the electronic prescription template module, so stick around to the end if you want to see that. To showcase the full potential of the DentalRx app, we'll go through a dentist journey through the app as they help our patient, Sarah, who has a mechanical heart valve. So first thing we'll do is sign in, and then we're brought to our dashboard. From here, we can see the patient medication history module, the prescribing monographs module, practice guidelines, clinical calculators, and then prescription templates. We can also see how many patients we've helped, as well as if we need to, we can message a pharmacist using the in-app messaging system. First thing we'll do though is go to the patient med history, where we can look up Sarah's medications, and luckily she provided us a list so that we can enter them from there. First thing she provided us was metoprolol. Next thing she wrote down was Altase, which is the brand name for Ramipril. And then lastly, she wrote down warfarin. So here we can analyze the prescriptions, and here we can see our results, the drug names, drug use and class, dental drug interactions, as well as dental pearls. In this circumstance, we're going to be paying attention to warfarin and the dental pearls, which say that we should monitor INR and also expect increased intraoperative and postoperative bleeding. So we can go to our practice guidelines and take a look at anticoagulation. We know for someone who's been on warfarin that if they've newly started warfarin or if they have a history of labile INRs, we might want to modify their warfarin schedule. But in this circumstance, Sarah hasn't recently started warfarin. She's been on it for a while, and she doesn't have a history of labile INRs. Her INR is 2.9, which is right in range. So we'll go back, and since Sarah has a mechanical heart valve, we do know that she will need antibiotic prophylaxis. The reason is because infective endocarditis is at increased risk when someone has a mechanical heart valve. So for Sarah, we might want to prescribe amoxicillin 2 grams 30 minutes prior to her dental procedure. From here, we can go to prescribing monographs and take a look at the antibiotic that I just mentioned, amoxicillin. So here, we can see the dose is confirmed as 2 grams. And if there's any dental pearls that we'd want to take a look at, contraindications, drug interactions, pregnancy and lactation risk, as well as dosing forms and Canadian drug benefits. From here, we're going to go to clinical calculators. We're going to calculate the total amount of anesthetic that Sarah can get. So she told us her weight is 80 pounds, and the anesthetic that we're going to use for her is lidocaine. So here we see that the max dose is 159.7 milligrams, and which is a max volume of 8 mils. So we can give her 4.7 carpules. Now we're going to go to prescription templates, and we're going to write that prescription for amoxicillin. This is going to be a preoperative prescription, so we're going to go to this module. And here we're going to select amoxicillin, 2 grams, 30 minutes prior to procedure, 4 500 milligram tablets with no refills. We can also select or unselect any patient instructions for when the patient comes in to see us. The patient doesn't smoke, so we don't actually have to mention that. Now we're going to preview our prescription. Here we can see our prescription, as well as any patient instructions for the patient. Now we're going to print the prescription, and this is printing on our printer here at home. But in this circumstance, I'm not going to waste paper. And after the prescription's done printing, we can either send that to the patient's pharmacy or we can give it to the patient directly. That concludes our patient journey and dentist journey. But if we had any other questions, we could always message a pharmacist. And we can do that through the in-app messaging system, where we could select the pharmacist and ask our questions. But in this circumstance, we can actually just make do with an email, which we would send here. So thank you all for taking the time to go through the DentalRx app with me. If you have any questions, you can feel free to reach out to me. My email is admin@dentalrx.ca, or if you're interested in trying out the app, it's actually available on the App Store right now, as well as the Google Play Store. And you can also find it on the web at app.dentalrx.ca. I hope to see you guys on there, and I'm really excited to be part of the FlutterFlow Imagine Competition. Thanks for your consideration, and I'll see you guys next time.